My name is Lorene Wiley. I'm an OBGYN with Orange Coast Women's Medical Group, and we're here tonight to talk about menopause. Menopause, is this really happening? We're going to talk about some of the signs and symptoms to know, and also some of the treatment options. So first of all, what is menopause? Menopause is the permanent cessation of menstrual cycles. We determine this retrospectively after you've had 12 months with no menstrual periods, also known as amenorrhea, and there's no physiological or pathological cause for this. The average age of menopause is about 51.4 years. I tell my patients somewhere between 51 and 52 years. If this happens before the age of 40, we call this premature ovarian insufficiency. 95% of all women will become menopausal between the ages of 45 and 55 years of age. When we talk about menopause, we like to break it down into three main groups. First of all, we have perimenopause. Perimenopause is whenever those estrogen levels start to fluctuate and decline. This results in unpredictable periods. Surprise, this can last for several years. Next, we have actual menopause, where we kind of set that average age of the final period is somewhere between ages 51 and 52. We determine that retrospectively after 12 months with no period. And then we have postmenopause, and this is the time from no periods after 12 months to the end of your life or the rest of your life. During this period, you still can get some of those menopausal symptoms such as hot flashes. So kind of zeroing in on the time frames around menopause. So perimenopause, this is irregular or regular menstrual cycles. This can last for a month. This can last for a decade. Some of the common symptoms we see is vaginal dryness, changes in mood, changes in weight and metabolism, changes in your sleep, decreased libido, hot flashes, night sweats, and hair thinning. We know that the reason why this happens as your eggs and your ovaries are basically decreasing. With that happening, you have a decrease in your estrogen levels. Ovulation becomes irregular at that time. If you don't ovulate, you don't produce progesterone. If you don't produce progesterone, your periods will become irregular because that inside lining of the uterus isn't building up the way that it did regularly each month. And then we talk about postmenopause. So this is basically characterized by very, very little estrogen being released because you're not ovulating. If you're not having ovulation, like I said, there's no progesterone, there's no periods, and that uterine lining does not thicken at all. The symptoms that with perimenopause and postmenopause are really about the same. This is just more so like a graph that kind of represents what happens. We define premenopause as the time you have your very first menstrual period, or menarche. So at this time, your estrogen levels are high. Estrogen levels remain high up until around ages 35 to 45, and that's whenever you see that sharp decline. With that sharp decline of perimenopause is whenever you start to see the symptoms. The sharp decline ends around menopause, which we said was around age 51 or so, and that lasts for the rest of a woman's lifetime. And you can really see the graph where you have the high levels of estrogen with the green, and your symptoms are mild because you have lots of estrogen, ranging to strong symptoms with the orange and the red. Here's just a little funny about menopause and how it can change a woman. Number one complaint, I hear it every day from my patients that are going through these menopausal changes. I'm having hot flashes, especially right now. It's California, it's August, it's hot, but these hot flashes are a little different. Basically, you see the sensation of heat on the upper chest and back and face. It starts there and then it basically becomes generalized all over the body. These hot flashes can last anywhere from 2 to 4 minutes. Hot flashes are associated with perspiration or sweating. Sometimes you can see palpitations, sometimes chills and shivering, and also some anxiety that happens with it. You can see this occurring between 1 a day to 1 per hour, and sometimes even more than that. 80%. So the majority of women will experience hot flashes for more than 1 year. But the good news is they usually resolve in about 4 to 5 years. Sleep disturbances. Number 2, as far as complaints go. Sometimes these sleep disturbances are because you're having hot flashes, and sometimes it's just we don't not associated with them at all. Sometimes we see it just because of that change in your circadian rhythm as you're getting older. Sometimes it has to do with anxiety, weight gain, sleep apnea, and other non-gynecologic related causes. About 30 to 40% of women report that they had interrupted sleep in that early menopausal transition, and a little bit more report sleep issues in the late transition. Next, we have vaginal dryness, also known as atrophy. We know that the epithelium or the skin of the urethra and vagina are estrogen dependent. When you don't have estrogen, you get thinning of that tissue. It turns from cells that were once more so like fluffy to cells that are more like papery thin. We see vaginal dryness, itching and pain with intercourse. Sometimes patients will complain of burning and swelling. This usually presents initially with a decrease in lubrication with arousal prior to intercourse, and then this progresses to the vagina or the tissues of the vagina becoming pale, less pubic hair down below, the tissues aren't as elastic as they were before, and then the vaginal opening becomes narrower. Sometimes this can also lead to fusion of the labia minora. Next, we'll talk about sexual function. So as those estrogen levels drop, so does the blood flow to the vagina and the vulva. In addition, there's a natural reduction in the production of testosterone from the ovary. When we see this decreased blood flow, it affects the vaginal lubrication and overall arousal. As a result, a woman may not be able to enjoy sex as much and may have difficulty achieving orgasm. Sex can sometimes become uncomfortable and even painful. There was an article published in the Journal of Women's Health that talked about women who had more significant side effects associated with menopause were likely to report lower libido levels or lower desire to actually have sex. And it makes sense. Who's thinking about sex when all of the other symptoms of menopause are going on? Some ways you can cope with the symptoms. You're tired, get some caffeine, vodka, Xanax, latte to go. And sometimes women will smile to just cope with how overwhelmed these symptoms of menopause really are. So menopause is really a time that says, hey, your body's changing. The number one thing we kind of talk about to battle these changes is taking care of yourself, making healthy lifestyle choices. One of the first things we kind of talk about is becoming physically active or making sure that you're staying physically active and eating well to make this transition in the midlife more easy. As far as nutrition is concerned, we talk about things that are heart healthy. So you want to focus your diet on things that aren't processed as much, such as veggies, fruits, whole grains, and lean meats. Also, you want to eat more nuts, seeds, and plant-based oils, such as olive oil. Things you want to look for or put into your diet are calcium and magnesium, and also vitamin D. These are things that are really important for healthy bones in your midlife. You want to eat 2 to 3 servings of dairy each day for calcium, and then you can get magnesium in nuts, beans, broccoli, spinach, and whole grains. You want to avoid prepackaged foods. We know that quick prepackaged foods have more calories, and these can add up quickly. As far as veggies are concerned, you want to eat veggies at 2 or more of your meals or snacks each day. You can throw veggies in your smoothie in the morning, and then just have like some with lunch and also with dinner. You can try adding tomatoes or avocado to your breakfast plates, raw vegetables at lunch, half a plate of cooked vegetables or salad. Other things about fewer calories. We know that your metabolism starts to slow down around the age of 40. So if you don't decrease your caloric intake, then it's going to result in weight gain. But a way to combat this is increasing exercise, building muscle, so that way you're burning more calories than you're eating. Other things we talk about, we kind of already mentioned the vitamin D and calcium, which are essential for your bones, your teeth, your muscles, and your nerves. You need calcium for your blood to also you need calcium for your blood to clot properly. Deficiencies in calcium can lead to osteopenia, which is like early softening of the bones, or osteoporosis. We need vitamin D so that we can absorb the calcium. Vitamin D is found in things like milk, cereal, salmon, egg yolks, and some mushrooms. Other things we think about are B6. You need that for your immune system to help function or to function normally. And you can find B6 in plant and animal origin foods such as fish, meats, fruits, and legumes or beans. Fitness. Fitness is very beneficial during menopause as far as benefiting weight gain. We know that during that menopausal transition and whenever you're in menopause, you tend to lose muscle mass, gain abdominal fat. If you are more active, it helps to reduce your risk of cancer. We know that exercising during and after menopause can help you lose that weight, or it can help you maintain a healthy weight, which might offer protection from certain types of cancer, such as breast, colon, and endometrial cancer. Fitness can help strengthen your bones. It can help slow bone loss and help prevent osteoporosis and fractures. And also exercise is good for your mood. We know that women that are more physically active have a lower risk of depression and also cognitive decline. Treatment. How do we treat these symptoms that are associated with menopause? So one of the common things I see in my clinic is complaints of vaginal dryness, and that's due to the atrophy that we kind of talked about with the decreased estrogen levels. We know there are over-the-counter options to help treat vaginal atrophy. These are water-based vaginal lubricants and also moisturizers. A holistic option is almond and coconut oil. You can use those safely to help with dryness and atrophy of the vagina. Hyaluronic acid is not only good for your face, you can also use it for your vagina. There's certain formulations that are good for vaginal atrophy. And then just staying hydrated and continue to have sex regularly will help as well. Hormone replacement therapy. So when we think about hormone replacement therapy, the traditional route is giving the body back what it's missing. Everything I've said that has to do with menopause and the symptoms are the estrogen levels that are gone now that you're not ovulating anymore. So we want to treat that with estrogen replacement, plus or minus progesterone, plus progesterone if you still have a uterus. If you do not have a uterus or if you've had a hysterectomy, you don't need that progesterone anymore. And also sometimes we'll use testosterone. When we replace estrogen, it can be in the form of a pill, a patch, or a pellet. As far as progesterone replacement, mainly we do that by a pill or sometimes creams that can absorb into your skin. We know that testosterone replacement we can do via a lozenge, a transdermal cream, or a pellet. There's bioidentical hormones. Basically, these are non-synthetic plant-based hormones. They're biologically identical to human hormones, but they're not any more safe or effective than traditional HRT or hormone replacement therapy. But we do offer these in pellet form, and this is based off of lab work to see what those deficiencies in those hormones are. And then vaginal therapy we can do via a pill, a cream, a ring, or a suppository. Hormone replacement therapy. When do we use systemic therapy versus vaginal therapy? We want to think about safety concerns, who's eligible, and what are the symptoms that we're trying to treat. There's the Women's Health Initiative study that looked at hormone replacement therapy. We know that everything that we do, there's risk involved. So they did see an increased risk of breast cancer sometimes, especially in women that were more susceptible, an increased risk of clots or stroke. But as far as benefits of hormone replacement therapy, there was a decreased risk of colon cancer and also, a decreased risk of colon cancer and also a decreased risk of osteoporosis. Whenever we're replacing hormones, we want to make sure that we're compliant and follow up in clinic, making sure that everything's okay. The hormones that we're replacing, the patient's tolerating them okay. But we know that hormones are not the magic bullet. We can replace them, but it won't necessarily take you back 100% to where you were prior to menopause. Here are some common myths that we see with menopause. Number 1, menopause begins at age 50. This is false. We know that every woman's different. We said that usually it's somewhere between ages 45 and 55 for menopause. So it really just depends. Second myth, if you have an early period, you're going to start menopause early. False as well. We know that menopause and the time of when you begin menopause begins on genetics, lifestyle, smoking, etc. A woman's not officially in menopause until she's gone an entire year without a period. And if she doesn't have a period for 9 months and then she has one in the 10th month, then unfortunately we're back with the countdown for those 12 consecutive months with no period to equal menopause. Myth number 3, weight gain is inevitable in menopause. Yes and no. Like we said, we have to think about the metabolism and how to manipulate those factors. Burning the calories that you eat, how much fat you're intaking, how much fat you're burning to help regulate your blood sugar, help burn calories, help to not gain the weight. And the fourth myth is that your sex drive is going to decrease with menopause. Just because you're in menopause, you don't have to accept that the loss of libido is normal. If your desire for sex is low, maybe you should talk to your doctor and we can figure out a way to increase that. Libido is complex for a woman and there's no magic ingredient, unfortunately. And now that we've concluded the presentation, I'll take some questions from the chat. So the question from the chat, if I can't take HRT due to a very high risk for breast cancer, would eating more soybeans, tofu, edamame help? So not necessarily. They've looked into some different things like some yams or some different things that there's been like some studies about that will kind of help with those symptoms. It might help, but we're not 100% sure that those 3 things specifically will. If your number one symptom is, let's say, vaginal dryness, we do know that we can use some of the more holistic things like the lubricants, the coconut oil, etc. And also vaginal estrogen is safe to use in patients that are at high risk of breast cancer because there's not much systemic absorption of that. So something to just think about. If your symptoms are more so hot flashes, we have things like paroxetine and Effexor that would help with that. So it just kind of depends on what your primary symptom is. What are some in the moment ways to manage symptoms like hot flashes, night sweats, etc.? So some things we think about as far as like, not necessarily in the moment, but to kind of prevent some of the hot flashes and night sweats, we think about avoiding spicy foods, limiting caffeine intake, wearing light clothing, keeping a fan with you would be the recommendations to kind of manage those symptoms for the most part. Is black cohosh effective? It might be. Like I said, some of the things that we know have some efficacy aren't as studied as well. So it's not necessarily a recommendation for menopause, but for some women it can be effective as far as managing symptoms. Are estrogen or other over-the-counters helpful with hot flashes? This is another one that can be helpful. Like I said, the mainstay of treatment for hot flashes is giving back that estrogen. So it's a question of, are you interested in true hormone replacement therapy via the estrogen patch or cream or whatnot? As far as some of the over-the-counters, like I said, they haven't been studied well. So they're worth a try, but can't 100% say that they will work for you. If periods are still regular but approaching the age of 50, should I start HRT? So hormone replacement therapy, like I said, there's risk and benefits with it. So the question would be, how are you having symptoms? Not necessarily age would make me say like, hey, let's definitely get you on some hormone replacement therapy. But if you're starting to have some of those symptoms that are interfering with your life, hot flashes that are unbearable, periods that you can't predict, or like really irregular bleeding, loss of sex drive, etc., then I would say that considering HRT would definitely be helpful. But I wouldn't recommend it based on age alone. One more question from the chat. My doctor placed me on antidepressants to help manage menopausal symptoms, but it's not helping much. Should I consider HRT instead? So as far as antidepressants go, we know that Paxil and Effexor are really effective as far as managing hot flashes. As far as other things that are associated with menopause, maybe not so much as far as like libido. So I would say it's definitely worth a chat with an OBGYN like myself or any of my partners in the office to see if HRT might be a better option for you other than the antidepressant. Okay. Thank you. Is it true MDs are using Paxil and Effexor for menopause mood swings? Yes and no. So we know Paxil is FDA approved for menopausal symptoms such as hot flashes. Effexor not necessarily FDA approved, but we know that it works well. So if I have a patient who is having symptoms of menopause, including the mood swings, I think it's worth the conversation saying, hey, can we combat those symptoms with something like Paxil or Effexor to help with the mood swings as well as the other menopausal symptoms. Are blood tests recommended before starting HRT? So for traditional hormone replacement therapy, and this is like estrogen, like in the form of the patches and oral or progesterone for protecting the uterus, typically no. You don't have to test those hormones. If a patient comes in and says, hey, my bleeding's all over the place, I'm 52, I haven't had a period in 12 months, we kind of know what's happening with those hormones. We know that estrogen and progesterone are low. So it's safe to start hormone replacement therapy. If you're considering something more so like a pellet therapy, then that would be a reason to get the lab work or the blood test prior to starting or prior to getting a pellet placed. What % of women are on HRT? That's a good question. I'm not 100% sure. I'd have to look at some data to answer that question. Does Mirena IUD affect menopause? So the Mirena IUD won't necessarily affect timing of menopause. Sometimes if you don't have menstrual periods with your Mirena IUD, then you don't know that you're actually in menopause because you're amenorrheic by virtue of the IUD. So that progesterone therapy that you're getting from the Mirena can sometimes help with symptoms, but it also could like mask the fact that you're actually going into menopause. And then I think this is a repeat question about the estrogen, basically just saying that it might be able to help with the symptoms. It's worth a try, but we don't have like good study data that says 100% that estrogen will help with the symptoms like we do with our HRT, with our Effexor, with our Paxil. Alrighty, I think that's all of my questions. Thank you so much for joining me tonight to talk about menopause.